Good morning, everybody. Thank you so much for joining us. Welcome to the webinar for the VicHealth Partnership Grants in the Arts. My name is Renee Imbezi and I'm here with Jim Rimmer. We're both in the mental wellbeing team at VicHealth. So the two streams we'll discuss today are the Everyday Creativity Grant and the Art of Good Health Grant. So in this session, we'll cover the VicHealth Action Agenda and priorities. We'll talk about the partnership grants overall. Then we'll look at the Everyday Creativity stream and the Art of Good Health stream and finish up by talking about the application timelines. And then we'll move to have some time for online Q&A, which will be recorded and published at a later date. So thanks again for joining us. Let's start with VicHealth's Action Agenda. So back in 2013, we set a 10-year action agenda or strategic plan with these 5 focus areas, or what we call imperatives. It's been 6 years since then, and in August this year, we released an update on the action agenda. We're still very focused on those 5 strategic imperatives with some other themes that I'll mention in a moment. So this is particularly important to note for the Art of Good Health grants, as we're looking for projects that are aligned to these 5 areas. Our 5 imperatives are encouraging regular physical activity, preventing tobacco use, improving mental wellbeing, promoting healthy eating, and preventing harm from alcohol. So in each of these areas, we have a specific strategy with its own priorities, and you can find those strategies on our website under Action Agenda. I'll follow the links on this slide when it's published at a later date. So in addition to these 5 health areas, we also have 3 themes that run across all our work, and we'll turn to those now. So these are the 3 themes that go across all our work. I'll just talk about them one by one. Health equity is about ensuring access to health and wellbeing is available to all. Our Fair Foundations framework describes the principles and evidence behind this and how we focus on the determinants of health inequalities. Secondly, our research work is underpinned by an impact approach based on partnerships, and we're also focused on increasing the flow of knowledge from research to practice. And thirdly, our arts work, which we'll talk more about very shortly. We also have a strategy in each of these areas with its own priorities, again, all available on our website and through the links on this slide. So I'm now going to hand over to my colleague Jim to look at 2 more aspects of our updated action agenda.
Firstly, we have articulated 6 insights that will guide our work, and many of these go across several of our health imperatives. The insights are in orange. I won't go through them in detail, as you can find them at the Action Agenda link on our website. We've provided a link through the document, and you'll see that the Action Agenda aligns current state government policies and priorities. The final aspect of the Action Agenda for discussion today is the determinants of health, which are extremely important for the arts partnership grants and may be familiar to people with health promotion and/or other backgrounds. Some say another word for determinants is causes or drivers. It's about looking at the underlying drivers of health problems, and on the flip side, thinking very strategically about solutions. People often refer to this as being upstream, as it's about exploring what is causing the problem or the outcomes. So this diagram looks at the determinants across 3 different levels, from the individual micro level to the societal macro level, and what influences health outcomes. You will remember that I mentioned our health equity theme earlier, and in that context, our Fair Foundations framework uses a similar model to explain unequal health outcomes in Victoria. Again, we have provided a link, and it is also available on our website as a planning tool. One more thing we wanted to point out from VicHealth is that it is relevant to these grants, which is co-design. Many of you will be familiar with the notion of co-design, which is to work with your target group at the table from the start to the finish, and from design to delivery and beyond. These concepts are often inherent in arts and creative work, but they can be newer to organisations organisations like local councils and health agencies. At VicHealth, we are also on a learning journey with co-design and have some resources available for co-designing with young people specifically, available on our website. Plus, there are heaps of other co-design resources available online. We'll now move on to talk about the VicHealth Partnership Grants. If you are familiar with VicHealth, you will be aware that this is a new way of us approaching our grant offering. So instead of offering multiple grant rounds throughout the year, we are now offering them all at once with multiple streams involved. This current round opened 1 week ago and includes 7 streams. Today we will talk about streams number 1 and 2. If you're interested in the other streams, please feel free to tune in to other relevant webinars and of course look online. As a final note about these grants overall, we encourage you to look at the VicHealth Partnership Analysis tool, which is a useful tool for planning and collaborating across the life of a project, especially where you're bringing different sectors or disciplines to work together. So now I'll talk more specifically about the 2 arts grant offerings. For VicHealth, art is a very little word with a very big meaning. We apply this word to the fullest range of creative and cultural engagements, commercial to community, contemporary to traditional, all disciplines, all settings, all communities, all together, all the time. The arts can be used as a platform for increasing participation and community engagement, as an approach to creating dialogue, awareness, and exchanging ideas, as an important setting in its own right, but one that is also fluid enough to work with others, such as workplaces, education, and public spaces. That said, we are an outcomes-focused organisation, so we are always looking for the greatest health and well-being benefits. For arts and cultural organisations, it's worth mentioning that the alcohol culture change and healthy masculinity streams will also be open to arts initiatives, but have very specific frameworks to focus their work. More information is available on our website under each of these streams. Now I'll start talking about the Everyday Creativity Grants. In a nutshell, these grants are about increasing dose and diversity. Research has indicated that engagement of 100+ hours per year is optimum for mental well-being benefits. So we are interested in exploring how we can make more art more available to more people more often. And the solution isn't necessarily creating more art itself, but supporting the connections between community and creativity. Participation is the engine room of the arts, especially for health promotion, but we need to acknowledge that this is not evenly distributed. The arts can be a very powerful tool for increasing health and well-being, but this becomes compromised if the people who are in greatest need aren't being reached. The reasons people aren't participating are often more complex than just ticket prices and transport. They might include lack of awareness, lack of willingness, poor perception, lack of knowledge. They could include organisational challenges regarding access, facilities, affordability, perceived value. Everyday Creativity Grants will be directed toward local governments, working in partnership with others, cultural, arts, creative organisations and others, to address barriers to participation. Up to $150,000 is available per grant for projects 2 years in duration, starting in May 2020. The architecture for these grants is built on a need to deep dive into the motivations and barriers faced by some within our communities. So we've suggested a timeline for how funded activities should be delivered. In the first year, our thinking is that the initial 3 months be dedicated toward discovery, learning more about community, gaining insights, and defining the problem, which would then lead into a 6-month co-design period of ideation with users, partners, and other stakeholders toward development and trialling of prototypes. That testing period we envisage would last approximately 6 months, where Funding recipients would test minimum viable products in live environments and potentially returning to earlier stages if required. From there, we would enter stage 2, year 2 of the funding, which is 12 months worth of delivery, full implementation of solutions live in the community. Our preference is for projects that emphasise togetherness and social cohesion rather than working with different population groups in isolation. So these approaches might include advocacy initiatives, building new partnerships with community organisations, incorporating citizen input into funding or prizes or programming decisions, developing ambassador or mentor systems, ensuring marketing materials and their distribution focus on being inclusive, providing low or no-cost previews or familials, or bespoke experiences for target communities. And there are many other approaches we haven't considered. Here are the links to the grant information sheet on our website and the Everyday Creativity webpage also on our website. The links are easily accessible through vichealth.vic.gov.au. I will now hand back to Renee to talk further about the Art of Good Health grants.
Great. Thanks, Jim. Off we go. So one of the newest areas of our arts strategy is a more expansive framing of how the arts can contribute to health and well-being, and how arts and creative approaches can help us reach our targets across all the VicHealth's imperatives. So by way of background, the next slide just includes a bit of information about our arts strategy and how it connects with the grants. So our arts strategy, which has been uploaded into this webinar, will support new partnerships with arts, health and other organisations to creatively address health and wellbeing challenges, and it will align with the VicHealth focus areas, which we've talked about already. So this focus area is about bringing arts and health sectors together in partnerships and supporting them to design new ways to tackle our health imperatives. For VicHealth in this area, broadly, success means new evidence, new models for bringing arts and health together, and more people across sectors agreeing and nodding that bringing those sectors together is a good idea. In more recent years at VicHealth, we've explored how the arts can increase physical activity, how it can reduce alcohol harm, and we've also looked at how arts can help us with factors like race-based discrimination and gender inequalities. So we've started to foray into this area before, and now we're really ramping it up. The Art of Good Health grants are a really big part of this, and that's what we'll talk about now. So the key feature of these grants is utilising or applying arts and creative approaches to advance VicHealth imperatives, those 5 that we've talked about before. It doesn't mean you have to apply to address all those 5 at the same time. It can be one of those, or it can be more than one of those, but it doesn't have to be all of them at the same time. So the Art of Good Health grants will only be provided for projects that address these priority health issues, and we really encourage local councils to consider how their local issues and priorities align to these health imperatives. It might not be the same wording, but the priorities may overlap in your local area. More information about each of these imperatives is available in our action agenda and each of the 5 imperative strategies, as we referred to earlier. And each of these 5 areas, if you look at them, they're quite broad. So in our strategies, we've tried to spell out exactly what the priorities are for VicHealth. So those strategies are really important reading material for anyone who wants to apply for the Art of Good Health. So I'll just move on to talk about the 2 stages of this partnership grant. So the best way to think of this stage 1, which is what we're in now, is ideas, and stage 2 is delivery. Let's talk about stage 1 first, which is this current round of applications. So the Art of Good Health program will initially support 3 months of scoping, ideas and partnership development, and we're okay to fund up to 10 councils. The grant at stage 1 will support councils to bring their local arts and health partners together and co-design a project proposal. Each local government of the 10 can be funded up to $15,000 to support that 3 months of design activity with creative partners and other sectors. The design stage grants will be available for work to commence in April-May 2020 and be wrapped up by the end of August. So that's just 3 months to deliver. But because this is the ideas stage, there's no delivery to the community as such. When you commence work, you're actually commencing the partnership work, the bringing local agencies together, the ideas stage really, and planning a project together. The final output from each funded council will be a detailed project proposal. That's the output from stage 1, and that's really the end of stage 1. So for stage 2, which is delivery, VicHealth will open a separate application process in later 2020. So that's not the current round, but we're just informing you of what's to come. So councils who have successfully applied for stage 1 and be funded for stage 1 can then, in later 2020, apply for a further $150,000 for 2-year projects to deliver their project from 2020 to 2022. And it's probably a bit hard to get your head around all of that right now. The main message is that this first phase is funding to develop ideas and undertake design to then apply for further funding in stage 2. And that is a lot of information in one slide, so you might want to read it again. More detail, all of that detail is also summarised in the information sheet about the Art of Good Health, and of course it's all on the Art of Good Health webpage, available at the VicHealth's site. So to wrap up, we're just going to look at the timeline for applications, and these timelines apply to all of the grants, including Everyday Creativity and the Art of Good Health. The grants opened 1 week ago, Tuesday the 19th of November. They will close on the 24th of February 2020 with no extensions possible. And we aim to have all the successful grantees announced across all the streams by the 30th of April 2020. I think it's important to note that questions to VicHealth are open for the entire application period. It doesn't end today. You can submit a question at any time through the Partnership Grants question page. Again, we have a link on the slide to make that easy for you. So thanks for tuning in so far. We're now going to open it up for your questions, which you can enter through your screen. We have suggested typing EC or AGH, depending on which stream you're interested in, but of course questions about both streams are welcome, and very general questions are welcome too. So off we go. Them, and we're receiving those questions, and we're putting you on mute sometimes to discuss how to answer them best. Your answers will start to trickle in back to you through your screen, but we'll also talk to some of them here. So there'll be a few things going on at once, and at times we might hand over amongst the team here, so just bear with us if it goes a bit quiet at this end. So the first question that's come in is, will councils be the lead of the scoping stage in the Art of Good Health? And the answer to that is yes, councils will be the lead for both of these art-related grants. And that also answers a later question about who employs the project officer. The local councils will be the lead, but that doesn't mean that partner agencies can't also employ project officers. In a sense, I guess the way to think about it is the council is ultimately sort of responsible and accountable and will speak directly to VicHealth as the recipient of the funding. There's also a question, is it expected that council would apply for the $15,000 before applying for the $150,000 for delivery? Yes, absolutely. You can't apply for the $150,000 for delivery now. The only applications that are open in Art of Good Health now are for stage 1, which is the $15,000 for the ideas stage. And only the councils that are successful in getting this stage 1 funding will be eligible to apply for the stage 2 funding next year. And we also noticed the thank you for VicHealth for realistic planning and application timelines. Gratitude noted. Thank you for that. I'll just hand over to Jim to talk about everyday creativity questions.
There's a question as to whether there's a standard application template to complete. For both grants, there are online links on our website. The application process is through an online portal. So the answer is yes. Everyday creativity grants will fund programs to increase participation, create activity to increase participation. It might be a combination of creating activity or linking to existing activities to ensure that the reach is maximised. It will depend on each specific program design. Will applications be looked on more favourably if they are collaborating with as many partners as possible? No, not necessarily. It's less numerically driven as to the program design and the relationship that is built in terms of delivery. So partners might be extending activities into a new population group. They might be assisting with research. They might be assisting with delivery itself. That's really up to the individual project. Everyday creativity grants are not accepting applications from organisations other than local council. Part of the rationale for this is that local councils in Australia are one of the biggest supplier of arts and cultural experiences to communities. So we see them as very, very, very valuable partners, and we're wanting to encourage stronger links between local council and arts and cultural suppliers, both commercial and community focused. Can you apply for both grants? Definitely. You can apply for as many grants as you want. My recommendation would be that council not necessarily apply multiple times for one stream, though we're not going to stop that either. It really is a matter of prioritizing your application and ensuring that the work that goes into preparing it makes it the best proposal possible. Can you link both grant focuses together? Unfortunately not in this round. This is the first time we've offered these two streams simultaneously, so we need to ensure they're a little bit siloed. I have read the info sheet for everyday creativity, but I'm interested in the format of the evidence. From Robin, that I guess is about identifying who in your community is missing out on arts and cultural experiences, and what evidence do you have to support that? That might take multiple forms. It could be in council surveys. It could be vox pops from those people themselves. It might be in data collected from local or statewide arts and cultural suppliers. Could be data from Australia Council, Creative Victoria, etc.
Speaking of evidence, there's also a question about what will be expected in terms of evaluation. So all councils that have funded through these streams will be required to undertake process level evaluation, counting in a sense who participates in your project, whether that be professionals from lead agencies or members of the community. But all funded councils will also be expected to contribute to an external evaluator for the VicHealth Arts Strategy, which VicHealth will commission separately, but funded councils and their partners will be asked to contribute to in some way. There's also a separate question, will one council, a rural question, yes, in relation to the Art of Good Health, is there an expected number of rural councils that would be considered for funding? Rurality or otherwise is not really a criteria as such, not an assessment criteria. However, I think it's fair to say that across the VicHealth Partnership grants, all the streams, as I mentioned, health equity is a really important theme for us. So in terms of Assessing the applications overall, and particularly in these grants, yes, I think the assessment panel will take into account sort of the spread of resources, if you will, and the spread of projects and how they benefit different communities across the state. That's probably a very general answer. The short one is rurality is not an assessment criteria, but it will probably come into consideration in how the grants are distributed overall. There's questions around how many grants will be provided. So in Everyday Creativity, we will fund up to 7 councils for a 2-year period. And in the Art of Good Health, just speaking about stage 1, that $15,000 is available for up to 10 councils in stage 1. So that's the application process that's open now. And then when we get to stage 2, we're looking at funding up to 4 of those 10 councils. But again, that'll be separate, subject to a separate application process. Here we are. Thanks for bearing with us. So we're just sorting through the questions. Thank you so much for the questions coming in. So there was a question, I think, from Jules there, in relation to the Art of Good Health. Can any of the project funds, if successful, be used for installation of artwork? And then I see there's a sort of later linked question about what the model might be. I suppose the best way to think of it is that this ideas design stage is really that. If you've already got an idea, then it's about bringing other partners around the table to look at what their role would be in delivering that idea, because stage 2 will again fund partnerships. So I guess, if there's a set idea about what the model or art might be, that's one approach, but another approach is to really bring partners together in the local area and say, and with a more of a blank slate, and say, what do we want to do together and how might we work together if that's new for the different sectors coming together. So in summary, we won't be funding installations in the design stage because it's a design stage in an ideas sense. Whether your design stage leads to the installation is really up to you and the project proposal that you submit to us at the end of stage 1 if you're funded. I hope that helps. Just looking through the questions. There's another one in relation to Art of Good Health. Will the Art of Good Health grant stage 1 be offered again in late 2020? The answer is no. Stage 1 will only occur this once. Yes, okay. Can the project be based in a hospital setting? Our answer to that is no, in the sense that hospitals aren't generally settings for health promotion as such. They can be, certainly, and they have aspects of health promotion. But our interest here, I suppose, is making sure that health promotion through arts and creative approaches occurs outside of traditional health settings. And it's also about preventing some of those health issues arising in the first place rather than a treatment approach. So I hope that helps with that question. Is it okay for an arts organisation to work on different grants with different councils if the project is different? I might hand over to Jim to talk to that question.
The answer to that question largely depends on organisational capacity of the arts organisation, and also addressing any concerns that might be raised by the assessment panel during their deliberations. So the opportunity to submit letters of support, I would suggest, should address that capacity issue if multiple projects were to be supported for the same arts organisation. Our model will look at a mindful walk with active participation in the formation of this. That's a process that I would recommend trialing with target audiences. We are really wanting projects to do a lot of community consultation and make sure they're really hitting the mark rather than working to any perceived early stage assumptions as to what is going to engage audiences. Can councils collaborate to deliver one project? Yes, we'd be very supportive of this. We historically have funded consortia of council to work together. They don't necessarily need to be part of the same geographic footprint either, though ultimately one council would be the contractual lead and funding lead for the relationship and partnership with VicHealth. So that looks as though the questions are starting to dry up. We might call it a wrap from here. There are other opportunities to ask questions through the website or the telephone line. We'll endeavour to address those as quickly as we're able. Thank you all again for tuning in to today's webinar, the first of this VicHealth series. Please reach out to us with further questions, or if you want to discuss the intent of the various funding programs. Thank you again for your time.